Welcome to examination of firearm policies and their effects on firearm injuries, mini symposia session. I'm Daniel Webster, Bloomberg Professor of American Health and Director of Johns Hopkins Center for Gun Violence Prevention and Policy. I'm pleased to be a faculty member with the FACTS Consortium as well. I want to remind everybody that the session is being recorded. The chat's disabled, so please use the Q&A feature for all your questions. A live transcript is available for this session. If you prefer to hide the captions, click the up arrow next to the transcript button and select Hide Transcript. I'm pleased to introduce this afternoon session. And I guess, just one sentence, about framing this is that I think everyone at this conference has bought into a public health approach to the problem of firearm injury and violence. And public health is population health, and if we're going to affect populations, we're going to focus on policy. So I'm really excited about our slate of speakers and topics for today. I want you to welcome our presenters, Dr. April Cioli. She's an associate professor in the School of Criminal Justice at Michigan State University. She's going to discuss the association between extreme risk protection orders and firearm suicide deaths. Following April will be Dr. Veronica Pear, Assistant Professor in Residence at the University of California, Davis. She's going to present on the implementation of California's gun violence restraining order law and its association with reductions in firearm violence. After that, we'll have Dr. Carissa Pelletier, postdoctoral fellow at the University of Michigan. She's going to discuss the effect of firearm laws on children and teen firearm homicide. And then we'll round this out with Susan Parker, a PhD candidate at the University of Michigan. She'll present on the effects of lockdown orders and returns from those lockdown orders on firearm injuries treated in U.S. emergency departments. Okay, we'll begin. I'll just say after the presentation, of course, we'll have a time for questions and answers. And again, please use the Q&A feature at the bottom of the menu there. So we're going to go ahead and start with April. You can share your slides.
Hi, everyone. I'm going to talk about the association between extreme risk protection orders and firearm suicide deaths in counties across states. And I do so as the representative of the Extreme Risk Protection Order, or ERPO, Multi-State Research Collaborative, which is funded by the National Collaborative on Gun Violence Research. Our members are highly esteemed, but far too numerous to name on this slide. Next slide, please. So extreme risk protection orders, or ERPOs, are civil court orders that temporarily prohibit the purchase and possession of guns by those at imminent risk of harming themselves or others. And this law, extreme risk protection orders, they were developed out of the recognition that some people who are high risk for gun violence can legally purchase or possess guns. So the adult male who is threatening suicide may be a legal gun possessor, and removing that gun from their possession could decrease their suicide risk in that period of crisis. Now, 19 states and the District of Columbia currently have some form of this law, and they vary somewhat from state to state. For example, who can petition for an extreme risk protection order? Some states only having law enforcement, other adding family members, and so on. These laws are relatively new, but we do have some research on them. Research out of Connecticut, for example, suggests that extreme risk protection orders do reduce the individual level risk for suicide. What we wanted to know is if we can detect population level changes in gun suicide in association with granted extreme risk protection order levels. Next slide, please. So we decided to do a county level analysis with counties in 5 states. We have, I believe it's 197 counties total. And we looked at the number of active full extreme risk protection orders per county month and its effect on gun suicide, the count of gun suicide. And we looked at the first 15 months of ERPO in each of these states except for Connecticut. Now, Connecticut's law turned on in the late 1990s, but it was infrequently used until 2012. So we considered January 2012 the start date for our 15-month analysis. We got the number of full ERPOs that were ordered from governmental sources, courts in all 5 states, and we obtained suicide data from the National Center for Health Statistics, restricted all counties' detailed mortality files. Next slide, please. So this slide shows a scatter plot of the number of active ERPOs per month for each county. So each county is a little tiny circle. And full ERPOs are in effect for about 12 months. Now this can vary if they're rescinded early, but generally they're in place for 12 months. So months 1 through 12 are really just adding ERPOs for the next month. Months 13 through 14, you have 1 month taken away, 1 month added. We see an increasing slope, not surprisingly, given how this is conducted, of ERPOs per county month. And we have some counties that stayed at 0 this entire time, so 0 ERPOs for this 15-month period. And a lot of counties that were, under 25 or so. As we get higher numbers, we get fewer counties, but some counties were really standouts. You can see in month 15, we have 2 counties that were well above 250 active ERPOs. Gun suicides, on the other hand, didn't really vary much over these 15 months. There was a mean of 1.7 to 2.1 suicides across counties per month. So it was fairly stable. Next slide, please. Our model specification. We decided to do latent growth and cross-lag models. Latent growth models allow for the estimated effects of ERPO on gun suicide to change over time, each month. So we estimated the effects of ERPOs in 1 month on gun suicides the next month. If we had done a fixed model, we would have gotten an average estimation, or an estimated average effect of ERPOs on gun suicide. And we wanted greater accuracy than that and more nuance than that. So we ran these latent growth curve models. We also did a cross-lag model. And that means that we estimated the effects of ERPO in time t-1 on gun suicides in time t. In other words, what is the estimated effect of ERPOs in month 1 on gun suicides in month 2? Next slide, please. This figure should make it all clear. So Y's are our gun suicides, and X's are our ERPOs. So what we have here, if we look on the left-hand side, we have the little G0, and G0 is the intercept for our gun suicides. And I told you that these didn't really vary across months, so we don't estimate a slope term for gun suicides. For our X's, our active ERPOs per county month, we estimate an intercept, H0, and a slope, H1. Now, what we're interested in here are our red arrows from X to Y, specifically those angled red arrows, the X1 effect on Y2, X2's effect on Y3. Those are our cross lags. And if I didn't mention why we're interested in the cross lag, it's because it can take some time, for the processes and procedures that the courts and police departments need to go through to get these ERPOs implemented. So we estimated that we'd need a little bit of time to implement the ERPOs. Next slide, please. So our estimated effects are in these tables. AE stands for active ERPOs, and GS stands for gun suicides. And I really should have flipped these, so it's AE on GS. Essentially, if we look at that very first row on the left, this suggests that active ERPOs this is active ERPOs in month 1 on gun suicide in month 2. Now we see that it isn't significant, but the intercept does have a negative value. In fact, all of our intercepts have a negative value. And our hypothesis is that the number of active ERPOs is negatively associated with the number of gun suicides the following county month. We do see that 4 of these estimates, they're in bold. So active ERPOs 4, on gun suicide 5, 6 on 7, 7 on 8, and 11 on 12. These are nearing significance, but they're not quite significant. When we look at G0 with H1, this is the overall trend of active ERPOs on gun suicide. And once again, we see a negative coefficient and a p-value nearing significance. So not quite there, but nearing significance. And our models could use a bit more power. Next slide, please. So what does this all mean? Well, the results indicated that our hypotheses, they're not quite supported because they're not totally significant. They're just nearing significance. But we are seeing the trend in the expected direction. It indicates that the number of active ERPOs in a month is associated with a reduction in the next month. Again, only marginally significant. What we're going to do next is add more explanatory variables, county characteristics. We're going to try to account for the proportion of ERPOs that are actually suicide related. Right now we have ERPOs that are only for risk of violence against others also in this model, along with the suicide risk ERPOs. And we want to add more time points, so go beyond 15 months. As we move forward in time, we gain more ability to do that. And we would like to add more states, though I'm not sure we'll be able to do that as part of this project. But there's a lot of room to grow, and these results are very promising. That's it for me. Thanks.
Hi, everyone. Are you all seeing that workshop? Okay, thanks. I'm Veronica Pear. Today I'll be talking with you about what was actually a chapter in my dissertation where I'm looking at implementation of gun violence restraining orders in California and subsequent firearm violence injury rates. Slide. So April did a lot of the explanatory work for me. Gun violence restraining orders are just what we call ERPOs in California. So they're just a civil law mechanism that temporarily prohibits high-risk individuals from purchasing or possessing firearms. In California, this law went into effect on January 1st, 2016. As April mentioned, 19 states and the District of Columbia now have some type of risk-based temporary firearm removal law. And back in April, President Biden was also pushing for more states to adopt. So given this, recent uptake in the law across the country, the question really is now, are these laws effective at preventing firearm violence? And there is some promising evidence, particularly with respect to firearm suicide in states with risk warrant laws, which are basically earlier versions of ERPOs. And both at the individual level and state level, studies have shown reductions in firearm suicides following the implementation of those laws. But we don't have any evidence about states with GVRO or ERPO laws, and we also don't have any evidence about effectiveness with regard to firearm assault and homicide. But theoretically, the same mechanism would be preventing firearm assault and homicide that's preventing firearm self-harm and suicide. So this is something I think that needs to be investigated. So the goal of this study really was to fill in some of these gaps, to look at whether implementation of GVROs was associated with a decrease in firearm violence. Slide. So we answered this question using the synthetic control method. It's a quasi-experimental design. The treated unit was San Diego County, and that's because they issued many more GVROs than any other county in the state. And then the donor pool consisted of counties in California that were either completely unexposed to GVRO implementation or were effectively unexposed meaning that they had so few GVROs that there couldn't plausibly be a county level association. So that left us with 27 counties in the donor pool. Slide. Our primary outcome was post GVRO, so 2016 through 19, biannual county level rates of firearm violence. This included fatal and non-fatal self and other directed injuries. And then in secondary outcomes, we looked at these separately. We looked at annual rates of firearm assault and homicide, and then annual rates of firearm self-harm and suicide. To increase comparability between San Diego and its synthetic control, we included a number of predictors in the model. These included county level demographic variables, as well as non-firearm crime rates, handgun sales, percent unemployed, and a measure of urbanicity. Our data ran from 2005 through 2019. Outcomes were from hospital discharge and emergency department visits, as well as vital stats. And then the predictor variables came from a range of sources that are listed here. Slide. So as I mentioned, we approached this with the synthetic control analysis, and I just outlined sort of the broad overview of the steps here. So first, it starts with an estimation of a convex combination of donor pool counties that are weighted in such a way that they're matching the pre-GVRO, so that's for us 2005 through 15, firearm violence trend in San Diego as closely as possible. It then uses these weights to predict forward into the post-GVRO period of 2016 through 19, predicting the counterfactual rate of firearm violence in San Diego had GVROs not been implemented. So now we have two rates, the observed rate in San Diego in the presence of the intervention of GVROs, and then the counterfactual predicted rate in San Diego in the absence of GVROs. And we can compare these two rates to get a difference and see basically if the rate in the observed San Diego under the intervention is lower than what would be expected. So then, of course, we want to know, is this difference meaningful, or is it, consistent with the null hypothesis? Is it random variation? So to answer that question, we conducted a series of in-space placebo tests, which basically consist of iteratively swapping in each donor pool county as the treated unit and then rerunning the analysis. And then that gives us the distribution of these differences under the null. And then we can use that distribution to calculate a one-sided p-value. And we did one-sided in this case because we hypothesized that it would decrease firearm violence, and there's no mechanism that we could think of that would lead to an increase. All right, slide. Okay, so turning to results, here on the left, we have San Diego and synthetic San Diego. We're looking here at firearm violence. So again, this is fatal and non-fatal self and other directed injuries. San Diego is shown in the solid line, and synthetic San Diego is in the dotted line. The vertical dotted line indicates the start of the implementation period. So here we can see there's a pretty good pre-GVRO match between San Diego and synthetic San Diego, but then in the post period, it basically looks the same. We're not seeing any sort of separation. This actually corresponds to a 1% decrease in San Diego compared to the synthetic control. But it doesn't look like anything significant, of course, and this is confirmed by the placebo test results that are on the right. So here, each line is the difference between the treated unit and its synthetic control. So that black line is showing the differences for San Diego, and then the gray lines are showing those differences for each of the placebo counties. And again, we're seeing that in the post period, the difference in San Diego is well within range of the distribution under the null. And then, of course, that's confirmed by the p-value of 0.5. Slide. Okay, so these are the results for, oh, sorry, one back, yeah, for assault and homicide. And again, we're seeing a good match in the pre-period. This time it looks like maybe there is a decrease that corresponds with, on average, 13% lower rate in San Diego compared with synthetic San Diego in the post-period. But then when we look at the placebo test results, we're seeing that, again, this difference is consistent with the null hypothesis, and the p-value is 0.35. Slide. Basically the same story here for self-harm and suicide. We have a good match in the pre-period. The post-period now, it looks like there might actually be an increase, and there is. It's about a 3% increase on average over the synthetic San Diego in the post period. But again, looking at the placebo test results, it's really clear that this is just, random variation, and it's another null result. Slide. Right, so conclusions. Obviously, everything was null, so GVRO implementation was not associated with a reduction in the rate of firearm violence in San Diego County during the first 4 years of implementation. I think there are several reasons why this could be. So for example, for the overall firearm violence and firearm assault homicide findings, it could be that those respondents are more plugged into the informal or black market of firearms. So for example, they could be disarmed through the intervention, but then if they know how to access firearms, for example, through friends or family members, they could easily get access again, which would, undermine the whole point. Another possible explanation for these null findings is that, in California, we do have a comprehensive firearm legislation already. So that could just be reducing the need for GVROs in this state compared to, other states that have found significant results. Because basically people moving through the system, if they're showing signs of high risk, there are other mechanisms that are preventing them from purchasing firearms or disarming them. Another possible explanation is that at this point, the exposure is just too rare to detect a population level association. We found a little over 350 respondents in San Diego County over the study period. So it's, probably worth checking back in a few years because uptake has continued to increase. And then of course, we also had a small donor pool, which means that we had low power in this case. And then finally, there just could be a true null that we've identified here. Our findings were quite null, as you remember. So, it's possible that at the county level, we're just not seeing an association because there's nothing there to see. But I do want to stress that these findings don't reflect anything about individual level effectiveness. It's actually entirely consistent with our findings that individuals subject to GVROs could have reduced risk of firearm violence involvement. But at the population level, we're not seeing anything. But this really should be the focus of future research, looking at individual level effectiveness, particularly in GVRO or ERPO states, and evaluating not only firearm suicide, but also firearm assault and homicide. Last slide. I just want to acknowledge my dissertation committee and the funders. Thanks.
Muted. Hello, everyone. I'm Dr. Carissa Pelletier, current postdoctoral scholar at the University of Michigan's FACS Consortium. So I'm right here in the thick of things. I am going to talk to you today about a portion of my dissertation, which looked at the impact of firearm laws on children and teen firearm homicide. Before I get started, I'd like to just thank a couple of people who helped a lot with my success. While I was at Arizona State University's School of Criminology and Criminal Justice, in particular, Dr. Jessie Pizarro, who you may have seen talk earlier. She has become a great mentor, friend, and she was my dissertation chair, along with April Zioli, who also spoke earlier, who did a lot of groundwork in mentoring me on how to look at firearm laws and the like, along with Doctors Shi Yan, Danny Wallace, and Kate Fox at Arizona State University. So that being said, I can go on to the next slide. Thank you. So my objective today is to talk a little bit about a portion of my dissertation. I actually looked at a total of 3 research questions, and this is just going to be the last one. So one of the main objectives as a part of my dissertation was to determine the risk factors for children in teen firearm homicide and how these risk factors differ at the micro, situational, and macro levels. So a lot of research has looked at risk factors at the individual levels and has largely ignored situational and community along with macro level factors. So I felt it was best and more important to look at these as a whole because firearm violence, especially against children and teens, is not does not occur in a vacuum. It does not occur in a controlled space. is a large confounding event that occurs over different situations in different areas. So my main research question that I'm going to talk about today is controlling for the differences in state and year. What are the most salient covariates of firearm homicides involving children relative to teens? Next slide. So the data for my dissertation came from 3 different sources, which I merged together to create my own massive data set. This included stuff from the State Firearm Laws Database, the American Community Survey or Census, and of course the National Violent Death Reporting System, the NVDRS. I examined 15 states across a 12-year time period from 2005 to 2017. You can see the states listed below. I'm not going to go through each one individually because I don't have time, but as you can see, there's a range of states here with a range of political affiliations, locations, and firearm laws. These states were also not chosen in particular because of any, implementations and removal of laws. These were chosen out of convenience of how long they had been actually reporting to the NVDRS. So I was not able to do like any kind of pre-post testing. So the methodology I used to examine this was multi-level logistic models. Next slide, please. So I did not include any of my massive tables because they did not fit on these slides. I examined a lot more than what you see here on this slide and then the next slide. Simply because these are only the significant variables. These ones were the ones that were significant. And if I had put up the actual slides that I had, the actual tables I had, you could not be able to read them, but I am more than happy to provide them. They also are available online at Arizona State University in my dissertation. So to start off, I'm going to talk a little bit about the independent variable. So the independent variable here was whether the victim was a child or teen. And so what I found was that children were less likely to be killed with a firearm, which means the opposite, teens were more likely to be killed in comparison to children. In terms of demographics, the sex of the victim being female, they were less likely to be killed with a firearm, while non-white and or Hispanic victims were more likely to be killed with a firearm. Situational level variables, this included stuff like the victim-offender relationship, the location, crime in progress, other things. Looked at some of the differences in the situation itself. So VOR, or victim offender relationship, those who were killed by a family member were less likely to be killed with a firearm. Those who were killed in the middle of a crime in progress, such as an armed robbery, domestic violence issue, a familicide, something like that, were more likely to be killed with a firearm. Those who died from abuse or neglect that led to death, or who had experienced abuse or neglect throughout their life, were less likely to be killed with a firearm. Those who were killed through excessive violence were less likely to be killed with a firearm. Excessive violence in this instance means they were shot, stabbed, or beaten to death. They were shot multiple times, stabbed multiple times, or beaten to death. The homicide being related to gangs, alcohol, or drugs, they were more likely to be killed with a firearm. And the location being outside in an outdoor area increased the likelihood that a victim would be killed with a firearm. Next slide, please. So these are, again, just the significant variables. So at the structural level or at the census level, the victims who were living in states that had a higher unemployment rate were less likely to be killed with a firearm. And victims who lived in states with higher rates of the population living below the poverty line were more likely to be killed with a firearm. Now, this may seem contradictory, but this is something that warrants further explanation, and it is important to keep it in mind. I was not able to narrow it down to the zip code or county. I looked at things at the state level. For collapse law variables, this simply means if the state had at least one of these laws, so if it had at least one child access prevention law or CAP law or permit to purchase law or domestic violence restraining order or relinquishment laws, DVROs, or minimum age requirement laws. So the only two that were significant here were that victims living in a state with at least one child access law were more likely to be killed with a firearm. And victims who lived in a state with at least one permit to purchase law were less likely to be killed with a firearm. And then when I separated these laws and broke them down individually and tested them individually, victims who lived in states that had other PTP laws apart from those required to purchase all firearms were less likely to be killed with a firearm, and those that required a license to purchase all firearm were also less likely to be killed with a firearm. And finally, victims who lived in states that had laws apart, DVRO laws apart from those that automatically prohibited DVRO subjects from possessing a firearm were less likely to be killed with a gun. Next slide. So again, this is just a brief summary of kind of what my dissertation looked into. There is a lot more there than what I was able to discuss today. And so some brief conclusions and implementations from my research would be that there needs to be more focus on creation of primary, secondary, and tertiary preventions that really target those individual and situational level risk factors, since those overall emerge as the most significant across all of my models. More targeted preventions in low-income minority neighborhoods that assist parents with the child rearing process and provide resources that assist further in that process, along with targeted preventions that are aimed at getting teens out of gang-related and drug-related activities. In terms of firearm laws, my research suggested that the implementation of may issue concealed carry permit revocation laws across states would be highly recommended, along with the implementation of more DVRO firearm prohibition laws across different states. Next slide. So thank you very much for coming to this today. If you have any questions, would like to see any further tables or learn more about this work, feel free to contact me. Thank you.
Wow, those were just great presentations, a lot of interesting data. Some questions are starting to pop up in our Q&A, and I'll just start to zero in on some of those, and I have one or two myself as well. So I'm going to direct one towards April. And April, you know, sort of pushing aside the precise statistical significance, I think there's a pattern evident in your data if you look at all of your coefficients in the general pattern over here. It generally is saying more ERPOs, less suicides, right? Firearm suicides. This is something you've been thinking about and working on a long time. And I guess the most direct question is, what are your thoughts about increasing ERPO implementation so that this is, I mean, they're clearly directed at very high risk scenarios. And what is the best thinking, yours or anyone who wants to share, on this? I think that's something many of us in the field are wanting to know.
Yeah, you know, we see a lot of counties that don't have any ERPOs for that entire 15-month period and beyond. Clearly, you know, those counties don't have zero gun suicides or zero firearm homicides. You know, so clearly there are more high-risk people that could benefit from an extreme risk protection order. Maybe their life could be saved. Maybe somebody else would not be the victim of firearm assault or homicide. So our thinking is, you know, kind of twofold. One, ERPOs really are for a high risk group of people. We need to be really, I hate to use the word targeted, but targeted in our approach to who is under ERPO. And part of that is going to be, you know, more education, getting the word out that ERPOs exist. One of our states, Florida, only has law enforcement officer petitioners. So in a state like Florida, it's about communicating with law enforcement, not only line officer law enforcement, but kind of the echelon of the hierarchy of, you know, police departments and sheriff's offices. Some units have risk protection order offices. In other places that have family members that are able to petition, or healthcare physicians who are able to petition. It might be more about talking to the public about when they see risk and that this is available for them. Because I highly suspect that not everybody in California where family members can petition know this is even a thing.
Yeah, that's a great point. I think there's a time maybe we want to transition to Veronica and, looking at this in a different way, looking at the population effects in a slightly different way in a county where, sort of the best bet was if you're going to see some impacts, you're gonna see it in San Diego because they've been very committed to this. Veronica, what are your sort of takeaways? Are we looking at this the right way? Is this sort of a research methods question, or is this just the nature of the policy in question and the outcomes? Not enough people basically exposed. So what's your thought about that?
Yeah, so I think it would be great to have individual level studies, basically, and I think that's where we have the highest, opportunity to see any sort of association or effect that might be there. At the county level, when we're looking at one county, like I did in this study, it's you just have low power, and that could be part of it. But it also, I think, is we just don't have enough maybe GVROs or ERBOs that have been issued so far. My hypothesis was that in San Diego, they're supposed to be these really highly targeted interventions, so we're finding those at highest risk. And if that's true, then we should be able, in theory, at least to see potentially population level changes, because it is a rare outcome. So even small changes in such a rare outcome like firearm suicide or firearm homicide could be, like 10% change, or something like that is detectable at the population level. So I think it is theoretically possible, but I also think that the results suggest that we should do more investigation into what kinds of cases are GVROs are being used for, because it could be that maybe implementation in San Diego or elsewhere, is maybe they're being implemented in a way that isn't sort of what we expect as researchers. Maybe they're not getting those at highest risk. So more questions have arisen.
Okay. Being someone who focuses a lot of my energies thinking about firearm policies, I want to direct this one towards Carissa Pelletier. And honestly, I was a little bit confused about one thing in your concluding slide, because you focus on implications, for concealed carry permits, but I thought, and in your results, they were really shining a light on permit to purchase as a protective policy against teen firearm injuries. So can you sort of clarify that a little bit for us?
Sure. Yeah, absolutely. So a lot of that actually came a lot from more parts of my different parts of my dissertation that I wasn't able to kind of discuss here. But I should have highlighted the fact that it was more what I was talking about in this presentation was that the permit to purchase laws and highlighting those and their impact on decreasing firearm violence against children and teens, as opposed to the ones that I did.
Okay, so there's another question for you in the Q&A. So
Yes.
While you're up here, I'm just going to fire that one at you. Any idea why child access prevention laws seem to increase death in your data? Certainly not what a lot of other studies have found. So does your model look at hospital or ER access, or what do you think is going on there?
That's a great question. That's actually one of the big questions that I have as well. And it's something that I've actually talked to with Dr. Zioli about. I have some suspicions, but I don't want to just take guesses in the dark. It's more of something that I'd like to look at further. And my model does not have hospital or ER access in the state at the state level. These are two questions that I've actually planned to look at further as part of the next steps on building on this dissertation. So they're great questions. I don't exactly have the answer for the first one. But yes, my model did not have those, but it's definitely something that I intend to include on future models and look at further down the line as I do more of this work.
Great, thank you. There's another question, this one from Jonathan Kim, that I believe is directed to Veronica. For Californians, the initiation of a 5150, 72-hour involuntary psychiatric hold, is theoretically associated with removal of firearms from the homes and bars people from purchasing weapons. Would a 5150 be a better proxy for ERPOs in California? What's your thought on that?
Yeah, so I love this question because it feeds in exactly to a study that we're just getting underway, where we will be comparing. So this is an individual level effectiveness study of GVROs and firearm suicide. So we will be comparing people who are respondents of GVROs with people who were issued a 5150, but then weren't actually committed to a psychiatric hospital. So this is basically indicating to us that they had some sort of event indicating high risk, but they then weren't actually prohibited from firearms because they weren't then, committed to the hospital. So we are gathering data for that study, and yeah, I think obviously it's a great idea.
Well, great. Thanks for clarifying that. We just have a couple more minutes. I wondered if any of our panelists have anything additional they want to add that they to anything. Just open it up there. No? Okay.
Well, I do have one
Sure.
thing. So,
Go, April.
I think that this, Veronica and my studies, and Veronica is part of the ERPO Multi-State Research Collaborative. She used San Diego data. San Diego data is part of, the data in the larger study. And, I think that this just highlights methodological issues that we need to sort out. We used very different methods, and we came to different results. And, maybe the study I presented just had a lot more power than Veronica's. Maybe San Diego wasn't doing much of anything, but the other counties in the study, saw some kind of effect. By having both of these studies and the results of both of these studies, we can start to really dig into what the differences are, why we're finding them, and what the real effect of these gun violence restraining orders / extreme risk protection orders are.
Well, that's a great way to end this session. It's been fantastic. We've been introduced to important policy questions, new data sources, new analytic methods. You guys have just been fantastic. I want to thank everybody for joining us.